we're starting here. We want people to start the week doing exercises every day and getting the feeling for the type of exercises we want you to get involved with. And this lecture is kind of the preface to the start of the exercises for the week to understand how important it is for your future health. And the program I teach is really a longevity program. It's giving you the ability to control our health destiny, and to say that the average age, that nutritional science has advanced to the point where the average age of most of us should be between 95 and 105 years old. We've advanced that far, and we should be able to realize that, and we want to protect our muscles and bones. And as we get older, the risk of having a fracture increases, and this is because, obviously, many different reasons. But the main theme of the presentation today is that whenever you hear that word osteoporosis, in your mind, you should immediately think to yourself that that means weak muscles. You got that? Osteoporosis equals weak muscles. Because the theme of this presentation, of course, is that the density of the bone is proportional to the strength of the muscle that moves it, and that your risk of having a fall or a hip fracture is not as closely related to bone strength as it is to muscle strength. So that's really the whole lecture right there. So now we'll go into the details of that. You got that so far? So if you plan to live to be 85, and I'm saying that we're planning all to live to be at least 95 now, right? The average American male dies at about 76, and the average American female about 78, but now we're adding 20 more years onto our life with this style of eating, and so then we have to protect that body we have. The word that reflects the weakening of the muscles and bones, well, the weakening of the bones with aging is called osteopenia or osteoporosis. Osteopenia is the milder form. More severe, it's called osteoporosis. The word to represent the loss of muscle mass with aging is called sarcopenia. And we don't hear much people talking about this word, but sarcopenia is the real cause of osteoporosis. It's normal for us to have atrophy of the muscle tissue. You notice how that's a cross-section of the thigh. If the thigh was cut across, we're looking at the femur and the muscle tissue around it. And that as we get older, the size of the leg doesn't go smaller or bigger, but the amount of muscle tissue so it's normal and natural to lose muscle mass with aging. And as we get older, the leg size might be the same, but it'll have more fat and less muscle, and there'll be more weakness there and less stability. We want to have to slow this process down and have it not occur, right? So you can't have this not occur by choosing what you choose to put in your mouth with your knife and fork. It's not going to choose that. That really has to be done by the lifestyle you choose to live with exercise to maintain the muscle mass in the muscles that move the hips and the lower back. And the major determinant of bone size, and we're talking here the major determinant of bone density, and the resilience or resistance of the bone to resist fracture is directly proportional to muscle strength. And when we test the muscle strength and measure it, we find that that's more predictive of future hip fracture risk than is a DEXA scan that detects your bone density. Because DEXA scans are not very accurate tests. They only test the density of cortical bone. That's the outer coating of the bone. They don't give you a good cross-sectional estimate of the whole density of the inner and outer portion of the bone. So we're saying that as fat mass increases and as muscle mass, lean muscle mass decreases, that process will occur with inactivity. If we go up in a spaceship, again, away from the Earth's gravity, and we stop using our muscles, the even younger astronauts in their 30s will lose muscle mass and bone mass from lack of weight-bearing exercise. So bone consists of both trabecular bone and cortical bone. Right? The trabecular bone is that inner-like bridging network inside the bone. It's like a sponge-like network. And as we get older, the thickness of the bridges and you lose some bridging as well if you're inactive. And vitamin D deficiency can accelerate the loss of those bridges. So you can see here in this picture of osteoporotic bone how it's not as dense and there's more space between the bridges. If you take medication, it cannot build back the bridging. It can't put more lines and make them build. The only way to build more bridging and to continue the amount of bridges is through regular use of stimulation through exercise. All right? And even medications that they give people to help thicken and strengthen bones do not touch the trabecular bone or increase bridging. They only mostly thickened cortical bone. And the DEXA scans do not measure trabecular bone. They mostly measure cortical bone. So obviously we need to strengthen the trabecular bone. The DEXA scan was, when it was set up about 25 years ago, some people who actually got together with the people who were first inventing the bisphosphonates drugs and sat in a convention with the people who had the scan material, who were inventing the scans. And they actually had a bar having drinks, and they decided that, this is a true story actually, and they decided that let's set the definition of osteoporosis. And it's just so that about half the women over the age of 60 get classified as having that disease called osteoporosis, right? So these are arbitrary lines to define what is osteoporosis or osteopenia. It's just an arbitrary numbers and definitions, labels set by the drug companies because they couldn't really sell a drug to everybody, and they figured, well, we'll sell the drug to half the population. Not every won't look, and we'll just define that. And so in reality, a woman at the age of 65 shouldn't really be able to do the same amount of push-ups that a woman at the age of 30 can do. There's some natural loss with aging. We shouldn't really see this as a disease. We should see this as a normal consequence of aging and a normal consequence of the lack of physical fitness in your life, right? So as that level goes from at 0, you're at the bone density of the average 30-year-old woman. As you go to 1 to 2, in the osteopenic range, you're 10 to 20% lower than the average 30-year-old woman, which is not so bad. And then as you get below 25% of the average 30-year-old woman, they define you as being a diagnosis of this disease called osteoporosis. And even that's not really a disease. It just means you're not doing enough exercise in your life, or you have some other things that may have caused your bones to weaken, which we're going to talk about as we go on right now. All right, let's go on to talk about the medications. The number one medications used, the Boniva, Fosamax, Actonel, that class of medication is called bisphosphonates. Those are called bisphosphonates. I think that bisphosphonates should be taken off the market. I don't think they should be permitted to be sold at all because they're such dangerous drugs. There's no classification of woman, unless she's really had multiple fractures, who should be on bisphosphonates drugs, because the major problem with them is they increase the risk of atrial fibrillation or irregular heartbeats. And they actually increase the risk of irregular heartbeats and atrial fibrillation by a huge amount. And the problem with these drugs is they last in your tissues for so long that once you're taking them for a few years, they still are active and functioning in your tissues for 5 to 10 years later. So once you develop the negative heart, once you develop the atrial fibrillation or some major problem from the drug and you stop the drug, your problem with your heart will not go away. It'll continue on for years and years after it was caused. Now, remember I was defining that osteopenia, right, the milder forms of osteoporosis. Most doctors are giving these drugs as protection, so the mild forms of osteoporosis called osteopenia doesn't advance to the more severe form called osteoporosis. And I'm saying, in the classification of osteopenia, that's a normal classification for a woman between the age of 50 and 70. Because that's normal. Osteopenia is what's expected to happen to a woman as they get older. We shouldn't expect a woman at 55 or 65 or 70 to have the bone mass of a 30-year-old woman. So they're giving these drugs to women who are essentially normal, and the use of the drug causes the osteoclasts and osteoblasts. Those are the two cells that remove and build bone, right? The osteoblasts build bone. The word B for blast means build, and the osteoclast means they carve or take away bone, right? Now, in a normal person, you're always building and removing bone all the time. We're always taking away bone and remodeling and building new bone back. What the drug does is it poisons or interferes with the removal of old bone. So it just causes the body to build bone, slows down the removal of bone. What that does is it makes the bone that's there older, not as young, youthful, not your body's always remaking itself, especially in response to exercise. So we're finding now that over the years, women with osteopenia put on these bisphosphonate medications are now found to have even a higher risk of fracture than if they were not put on any medications at all. It's because they're, after taking many, many years of it, it might strengthen or thicken the bone, but the strengthening or thickening of the bone that occurs from the drug is not as dense, it's not as, how should I say it, flexible as normal bone. It's more brittle, even though it might register, the bone might register well in a DEXA scan, the bone is more brittle and more likely to break because it doesn't have the flexibility and ability to really withstand impact and damage as would normal bone that was built by the normal body on a regular, ongoing basis through exercise. So to review this slide, we're saying here that these bisphosphonate drugs are high-risk medications. They cause reflux esophagitis and gastritis. They irritate the esophageal lining, right? And then what do doctors do when that happens? They medicate you with Prilosec or Nexium, right? And what do the studies show on Prilosec and Nexium show? That those medications double the risk of hip fracture. They undo the benefits of the bisphosphonates, and they cause you to lose calcium in the urine. So women who take, or any person who takes, even in men, who takes those acid suppression medications, right? They're called proton pump inhibitors, like Prilosec and Nexium and Prevacid, have a 50% increased risk of hip fracture. And then they'll have a side effect from those medications because they lower the acidity in the stomach, increasing risk of infection. Now you're at high risk of getting pneumonia. So they have to give you an antibiotic for the pneumonia you get from taking the Prilosec. So one drug leads to another drug, leads to another medical problem, leads to more drugs, right? And these medications can cause osteonecrosis. The word necrosis means cell death. Osteonecrosis of the jaw, or dead jaw syndrome, means you actually get the bone in the jaw dies in some women, which is very, very serious. They can need a jaw implantation. The mid-femur fracture, the word femur means the leg, the bone in your thigh. After years of use, there's increased risk of fracturing the leg bone, the long bones, bone pain and muscle cramping, which of course you can take medication for, swollen ankles and feet, and obviously the long-term safety data is lacking. Once these medications are in the body, stopping the medications doesn't stop the side effects. So their recent studies show that for women with osteopenia, the long-term use of bisphosphonates increased the fracture risk. They increased hip fracture rates by 84% and wrist fracture rates by about 50%. So this is the main prescription use for these medications are women with osteopenia. More drugs are prescribed for women with osteopenia than even compared to osteoporosis, where there's been no studies that show they're actually effective in that group of people. So going over now the common causes of hip fracture, which is the major cause of disability in elderly women, which can lead to prolonged hospitalization, infection, and even death. Because more than 10% of people women who have hip fractures die within a year after their hip fracture, right? It's a very serious thing. So the most significant risk factor is lower extremity weakness, that's what this morning is about, talking about making sure that everybody knows, especially women, that they have to work on their thighs and their hips throughout their whole life. And prescription drug for high blood pressure and heart disease, beta blockers, right, diuretics, which actually cause you to lose calcium in the urine, increasing the hip fracture rate. But those drugs cause you to become lightheaded and shaky on your feet, and they cause hypotension or low blood pressure, and they cause people to more likely to fall. So the second leading cause of hip fracture in women is the prescription use of high blood pressure and medications for the heart. Got that? Anxiety medications and sleep medications also are a major cause of hip fracture as well. So the use of medications is the major cause of hip fracture. And acid suppression we talked about, Nexium and Prilosec. A recent study followed 500,000 adults for 15 years and found that those who were using these medications, saying Nexium and Prilosec on a regular basis, had double the risk of hip fracture. We do need some calcium, but most people in America are misinformed. They think that calcium is the main reason that people suffer osteoporosis, and women are popping calcium pills left and right, thinking they're going to solve this problem. And the studies show that you take a high dose of calcium, and it has no benefit on preventing or solving the problem of osteopenia or osteoporosis. A smaller dose, like 400 to 600, is shown to be just as effective. And I'm also saying here that these studies are done on people who don't eat properly. The American diet consists of course, about 30% of calories from animal products and about 60% of calories from processed foods. And the meats of animals don't contain calcium. The bones of animals contain calcium. When a wild animal kills another animal and eats it, it chews the gristle in the bone, right, and they get the calcium from that. And when we kill an animal, we just eat the muscle tissue, leave the bones aside. So if processed foods like bread and pasta and oil don't have calcium in them, and the muscle meats, the chicken, the turkey, the eggs, don't have calcium, then it makes sense to tell people that the only way you're going to get calcium is by drinking milk. right? That's what people think. And that makes superficial sense, because if you don't realize that vegetables and seeds and beans and fruits contain calcium, if you don't understand that produce is a rich source of calcium, and your diet is mostly animal products or processed foods, then it does seem like the only way to get calcium is through milk. But the primary cause for hip fractures, of course, is poor nutrition in general, because when we get our calcium from green vegetables and beans and seeds, then we're getting the calcium packaged with a lot of other minerals that makes the calcium be utilized better at the level of the bone. Vitamin K, phytochemicals, isothiocyanates, all those nutrients that have been shown to reduce the risk of cancer also benefit the bones when they're consumed at the same time as calcium. So when you get more of your calcium from greens and less from dairy, or all of it from greens and none from dairy, the calcium is better utilized by the bones. So we're talking here that the primary cause of hip fracture is not a bisphosphonate deficiency. It's not a drug deficiency. It's due to, obviously, a sedentary lifestyle, muscle weakness, declining vision with aging, cigarette smoking, vitamin D deficiency, and of course, a major factor is the side effect of prescription medications. Now, women who engage in regular exercise are very effectively protect hip fractures, much more effective than women who take drugs. Exercise is much more effective than drugs are, and it increases muscle strength and balance, because the loss of balance and having a fall is the major cause of hip fractures. Falling is the major cause of hip fractures, not osteoporosis, right? And the fall is more related to muscle strength than it is to the thickness or density of the bone, right? So the type of exercises you do to protect against osteoporosis, obviously, should involve exercises that make you have better balance. As if you're balancing on one leg and somebody gave you a shove, would you fall over? Or you'll be able to step out and catch yourself, right? So we have to make sure that you have the ability to prevent yourself from falling. You have the agility and the proprioception and the strength as you get older not to fall down. And of course, exercise strengthens the inner and outer portion of bones. Vitamin A supplements is also one of the leading causes of osteoporosis in this country, because the 1.5 milligram of vitamin A, which is 5,000 IUs, the amount found in most multivitamins, that has been shown to double the hip fracture rate. I also said earlier that Prilosec doubles the hip fracture rate, right? And taking bisphosphonates can double the risk of not hip fractures, but can double the risk of wrist fracture or mid-femur fracture, right? There's certain parts of the bones that are just along, when the bone thins out into the lengthy part, into the thin part, that's the parts that's at risk for having the drug-related fractures. And vitamin A increases mortality, which means death. And the vitamin A supplementation in recent studies in the Cochrane analysis, and you'll hear that word Cochrane, C-O-C-H-R-A-N-E, from me a lot, because they're a very respected group in the Netherlands who combine all the studies on one particular issue. Like they'll put all the studies on, let's say, hip fracture and bisphosphonate use together into one result. So they've analyzed 150 different studies. So in this case, the Cochrane group, a very respected, impartial group that are not controlled by the drug company. So they often produce better results. In this case, they studied vitamin A supplements that people took them for 3 years, and they found that those people taking vitamin A supplements had 17% increased risk of death, mortality. And that means that was just taking them for 3 years. Imagine people taking vitamin A supplements for 20 years or 30 years. And 80% of Americans are deficient in vitamin D, and vitamin D increases bone loss with aging and increases the risk of cancer. But how many of you know that vitamin D deficiency increases the rate at which you develop sarcopenia? You got that? Now you know what sarcopenia means, right? Muscle weakness. So vitamin D deficiency does not just cause the bone does not just cause you to lose calcium in the bone. It also causes the muscle to shrink as well. So it's harder to maintain the strength of your muscles, and you don't have as much response to exercise when you're vitamin D deficient. Let me say that one more time. I'm going to the gym, I'm lifting my weights, I'm pumping on my legs, and the next week I'm stronger because I worked out the week before. I got stronger from the exercise. But with vitamin D deficiency, you work out, you do your stuff, the next week you're no stronger. Your body has trouble responding to effectively making yourself in response to exercise, building back stronger tissue if you're vitamin D deficient. And what's the best source of vitamin D? Is it the sun? Yeah, not really, because the amount of sunshine we need to assure vitamin D adequacy is so variable from person to person. Some people can get adequate vitamin D levels from a minimal amount of sun, and that's great for them. And other people with a significant sun exposure are still going to be vitamin D deficient. So there's 3 or 4 things to remember. One here is the most critical and important way to know if your amount of vitamin D is adequate is with a blood test, right? And everybody in America should know their vitamin D blood test result. It's much more important than a cholesterol level, especially for you guys. Why am I saying a vitamin D level is more important than a cholesterol level? Because your risk of having a heart attack once you're eating a nutritarian diet is 0. Why do you have to care what your cholesterol level is? It's going to be favorable anyway. It's not the major factor determining your risk. But a more reasonable and substantial risk that you could have is of osteoporosis or vitamin D deficiency related disease. The other issue is that we've lost a large % of the ozone layer, increasing the risk of skin cancer. And all the leading researchers in the field of dermatology and skin cancer recognize that if the people in America were going to get enough sun to assure vitamin D adequacy to prevent against cancer and osteoporosis, we'd cause a complete 20-fold increase in the epidemic of skin cancers, including melanoma, which could be life-threatening. So if every American assured vitamin D adequacy by getting enough sunshine with a depletion of the ozone layer, we'd have a complete epidemic of skin cancer. And of course, sun wrinkles your skin and causes squamous cell carcinomas, actinic keratosis, and other damage that disfigures you as well, and basal cell carcinomas that may not kill you but can disfigure you as well. So we have to make sure, whether you do it with supplements or some combination of sunshine and supplements with the right type of protection, we have to make sure that we get that level. And we're going to talk about what is that optimal level of the blood test. And I'm suggesting that optimal level is between 35 and 55 is the optimal level on your vitamin D 25-hydroxy blood test. And I'll explain why that's the case in the later lectures when we're talking about cancer. Okay? And for most people, that means the vitamin D level that they should consume should be about over 1,000, over 1,500 a day if you're using vitamin D3. Vitamin D3 is made from lanolin, which comes from the wool of sheep. It's not vegan. Vitamin D2, which is vegan, is not as strong and doesn't have as long as a half-life in the body. And if you're using vitamin D2, the vegan form, then you should take at least over 2,000 a day. And because the half-life of D2 is less, you have to be very regimented to take it every single day. If you're using D3, you can take a higher dose one day, double the dose one day, and skip a day and double the dose the next day. It's not as important that you take it religiously every single day like it is if you're using the vegan form. But even still, people's requirements could vary from one person to another. I have lots of patients and clients who need more than 5,000 a day to get their blood levels in the range of 35 to 55. Okay? So here's a study that showed that vitamin D deficiency was the major definitive factor leading to osteoarthritis, loss of cartilage in the hips and the knees with aging. And I don't know about this group here, but when I speak to regular groups of people who most of you have read my message or members on the website or read my books or a little bit more well-educated in nutrition. But when I speak to a native audience who haven't heard this message, and then we bring them up, and most of them haven't taken their blood test for vitamin D. They don't know their blood levels for vitamin D. And when we bring them into the back and test their blood and get back to them with their levels, we find that 80, 90% of them are deficient in vitamin D, severely deficient. And most of them are taking already multivitamins with 400 IUs vitamin D in it. So what I'm saying is that the RDI for vitamin D, the 400 IUs that's in most multivitamin, does not maintains the deficiency. It's very, very hard for a person to get normal levels of D with that amount of vitamin D. So probably in future years they'll catch up to the studies. So don't forget, this is very important, that if you're vitamin D deficient, you're not just causing muscle weakness and osteoporosis, increasing risk of breast and prostate cancer, but you're also increasing risk of developing osteoarthritis, which can be an irreversible condition if it goes too far. So this is very important. It's very important you know your blood level of vitamin D. And we know that we weaken our bones with excess animal protein and low vegetable intake. But here's the thing. We want to have that both too much protein, particularly animal protein, can increase the risk of calcium loss in the urine. But as we age, too little protein has been linked with osteoporosis as well. So the reason why most studies on vegans haven't shown better bone mass is because as they age, they haven't met their protein requirements, and the low protein levels have led to loss of muscle strength, overall body strength, and increasing the risk of osteoporosis. There's not a tremendous difference between the vegan populations and the non-vegan populations who are overeating animal products. So we're talking now about having a diet that has adequate protein without but more of the protein has to come from vegetables, because as the vegetable protein percent, and we're talking here about the high protein plant foods such as beans, greens, and nuts and seeds. Beans, greens, and nuts and seeds are the high protein plant foods. And they're incorporated in your diet with a sufficient amount. You get adequate amounts of protein to assure adequate muscle mass with aging. Caffeine and sodium, obviously cigarette smoking, vitamin A and vitamin D, medications we talked about. So this basically is a review slide to hammer home the point of what you're learning already. And you guys probably know that there's plenty of calcium in green vegetables, right? Look at how high, a couple of cups of green vegetables have around 200 to 300 milligrams of calcium in them. We want you to eat a mixture of raw vegetables and cooked vegetables. And one of my favorite vegetables is spinach. I love spinach. I love cooked spinach with mushrooms and onions and stuff, and beans, stuff like that. But I'm not having more than half of my green vegetable intake to be spinach. I'd much prefer to have a quarter to a third of my green vegetable to be spinach. We want to have a variety of green vegetables, and spinach contains a lot of oxalic acid, so much so that it binds almost all the available calcium in the spinach. So it's obviously, it's only Swiss chard, the chards, and the spinach and something like rhubarb that has the excessive amount of oxalic acid. All the other green vegetables we're talking about here, the collards, the broccoli, the kale, the bok choy, have low amounts of oxalic acid, and almost all that calcium is utilizable by the body. All right? So green vegetables, raw vegetables, lettuce, especially the green lettuces you're served here, are high in calcium, and beans are high in calcium. Even an orange has 60 milligrams of calcium. But you can see, if you're eating some beans and green vegetables, both raw and cooked, it's not hard to meet your calcium requirements and to eat and to consume somewhere between 700 and 1,200 milligrams of calcium a day without supplementation. So keep in mind that protein, the digestive efficiency declines in the elderly, but one thing that increases the body's ability to absorb and assimilate and digest protein is what? What do you think? Exercise. Right? If you exercise regularly, it increases the digestive capacity of the stomach to absorb calcium and to break down and utilize protein better. Right? So it's kind of like a self-fulfilling prophecy that lack of activity and your body starts digesting protein more poorly as well. Steamed vegetables, of course, are very, very high in protein. So here we're looking at, we're talking about all these green vegetables that have a lot of protein in them. Let's say an average of 10 grams of protein for a couple of cups, 2 or 3 cups, about 10 grams of protein. And then a cup of beans is pretty high in protein, about 20 grams or 15 grams of protein for a cup of beans. Lentils, edamame, split peas, all beans are pretty high in protein, about 15 grams per cup. You expect people to eat about a cup of beans a day. That's going to give them about 15 grams of protein a day. And a quarter cup of nuts and seeds a day, just an ounce, like an ounce and a quarter, an ounce and a half of nuts a day gives us about 10 grams of protein as well in nuts and seeds. Pumpkin seeds, sunflower seeds give us extra protein. And of course, the point here is that when you mix in the same diet the beans, the nuts and seeds, and the green vegetables, you're getting adequate protein for muscle building without increasing the acidity of the body or increasing the acidity of the urine, which would lead for calcium loss. So it's the way to really build up muscle mass and strength and to achieve adequate protein so you can build strong muscles is without raising IGF-1. We'll talk about that later. IGF-1 is insulin-like growth factor 1. IGF-1, if we raise that with concentrated proteins like animal proteins or egg whites or white meat chicken, that increases the risk of breast cancer and prostate cancer. Right? So we don't want to raise IGF-1. We want to get enough protein for muscle mass and for bone strength without pushing IGF-1 or without acidifying the body. And the way to do that is to have in your diet the beans, the nuts and seeds, and the green vegetables. White potato, we're going to talk about white potato a lot this week. If you eat a lot of white potato, because of the high glycemic effect, It's broken down to glucose in the body, has increasing risk of diabetes, interfering with weight loss, and actually having some increased risk in studies showing increased risk of cancer due to the high glycemic effect of white potato. And it's low protein, so the possibility that a vegan diet would be low in protein, not support old elderly bone mass, to support people to have great muscle tissue into your 90s, could be a diet too high in white rice and white potato. And look at the difference between sprouted grain bread compared to regular whole wheat bread. Double the amount of protein from having the mixed sprouted grains, like the manna breads, like the mixed and those other brands that make this and mix them together. They're very high, they have much more biological availability of the protein. And the sprouted grain breads, because they're made from beans, have more resistant starch and a much lower glycemic index as well. There's actually a study that took people off white potato and put them onto bread, whole grain breads, and found that the diabetic numbers and the diabetic risk dropped 30 to 40% just from switching white potato to whole grain bread. Not that I'm recommending that's a good diet, I'm just giving an example between white potato and bread and whole grains. So the prescription for osteoporosis is obviously, pay attention to your vitamin D level. We're talking about 2,000 to 3,000 a day, confirmed with a blood test. Eat lots of high-protein plant foods, especially greens, vegetables, and beans. Eat a large salad every day. And of course, you guys know that we want to eat the nuts and seeds with the meal that has the largest salad, because the nutrients in the raw vegetables are so powerfully associated with low risk of cancer. And since raw vegetables have such a powerful relation with lower rates of cancer, we want to get the maximum absorption of those vegetables when we do eat them, which means we want to chew them better. We want to chew our salads really well. And if we eat some nuts and seeds with the salad, it increases the absorption of those anti-cancer vegetables by tenfold. And let's go on to the exercises now, okay? Because these exercises, I thought about it and say, okay, so if we know we have to keep most places that have problems with women, and we're talking mostly about women because men get osteoporosis too, but because they're bigger to start out with, their bones are more dense, they're larger to begin with, when they get osteoporosis, they don't likely result in having fractures anywhere near to the same level as women do, because they have less money in the bank to start out with. So if they lose something, they're more likely to get in trouble. So we're talking here about exercises that build the thighs, that work the thighs, because thigh exercises build hip strength and femur strength. We want to keep the femur and hip bone very strong, the pelvic girdle that holds the hip very strong, and the lower part of the spine very strong, because those are the areas that develop problems when you get older. Your lower back and your hips are what we want to have you be a great body and great physical fitness and no back pain and problems and falls and injuries when you're going to be 85, 95, or 100 years old, right? And so that's why these exercises are designed to focus on those areas to really protect your body as you get older. And we know, for example, that riding a bike does not strengthen the bones in the hip, right? Because it's too smooth of a motion. There's no electrical impulses. It's the tapping or banging or hitting the bone that has the most effect at sending electrical impulses, activating the osteoblasts into activity to build new bone. So if I'm going to do an elliptical machine or a bicycle, even though it's strengthening, it's not going to be as effective as if I jogged or if I ran in place or if I hopped or jumped rope. Did you follow that? So a very effective So the key here is hopping, skipping, or jumping. That's a really key. So if I'm starting out, and I see a lot of patients in my office who might be in their 80s, and I can't have them hopping and jumping around. I start them, on more benign or more gentle exercises. So I start them out dancing, right? So a song usually goes for 3 minutes. So we start out dancing and lilting and bouncing, and we turn the bouncing into hopping and skipping, right? So as people get stronger and get better. So the basic, and that's what we're reviewing today. So every exercise I show you will try to give you a more basic way to do it, a more elementary or more gentle way, and then there's a more advanced way to do each exercise, so you can advance the exercises and adjust them to the level that you're at. If you have knee problems, you don't bend as low. In other words, you adjust each exercise to where you're at. You always, how should I say this? Err on the side of caution, because I don't want all you guys limping around, coming back, unable to walk here into the lecture the next day or so. because you may feel okay doing it and be really sore the next day for not used to doing this exercise. So kind of like underdo them a little bit, and as the week goes on, if you're feeling good from doing them, you can do them more and more. You'll take them home, you'll do them, start to incorporate into your schedule with them on a regular basis. But don't go crazy, unless you're used to doing exercises like this. So the hopping and the skipping, and some of the key here might be, like I might be one of the exercises we're going to do back in the San Bernardino room is we're going to be hopping around the room on one foot, right? We're going to be jumping around the room on one foot. That's a great exercise, right? And then you're hopping around the room on the other foot, the other direction. But we start out, as like just putting on music and bouncing on your legs without lifting the ground, right? And then eventually you can start to come off the ground a little bit, a little bounce with your hopping from foot to foot. Right? And then eventually you're going to be hopping and taking a wider step out to the side. And that's the most important exercise for a woman, is to be able to jump from side to side and hop out. Because why is that? Because the muscles that catch you from continuing to fall off the stage, right? The muscles that catch you are the proprioception muscles that actually put you in space and time and hold you. And those are the ones that protect you with falling. When you trip or hit a rug or get out of bed in the middle of the night and run into something and fall over, we want to develop the proprioception, means the nerves that trigger the muscles to put you back and right you back in balance again. So we want to actually practice and build the muscles that will protect us from falling later on in life. Right? So that's why. So this is another basic exercise, jumping from side to side. Not the one you may start with if you're 80 years old, but you want to build to be able to do that exercise. Notice that my free leg is going behind me. So as I build up on this exercise and get better at it, I can start bending lower and lower, so that eventually a more advanced form of the exercise is you're actually balancing as you're touching one elbow to the opposite knee. And that takes a little bit of strength and skill, which builds your thigh and your hip and your balance at the same time. And that's called jump lunges, because I'm jumping and landing in a lunge as I'm going from side to side. It's an exercise design that's really a good exercise. It's protective against osteoporosis. So going through this, lunge walks is just without the jumping. And how low you take a big step and you bend, right? A big step and we bend. That's called a lunge. And as you build up on this and you're starting doing it eventually, you start able to bend lower, so you can take a big step and touch the back knee to the ground, right? How low you bend, though, is you have to do it to your level. Some of you have been to our conferences before. We've been doing these exercises together, are very advanced. You'll be doing the advanced forms with me. And others of you will be taking just a little step because you haven't done these exercises that much. And you'll increase the amount you bend. Chair squats. We're trying to make these exercises so you can conveniently do them in your own home. And a chair is a great exercise tool because it tells you how low to bend. And almost everybody can get up and down from a chair, right? I mean, most people can sit in a chair and get back up again, and that's exercise. Sitting in a chair and get back up again, and rocking your body back and rocking it forward and getting back up again. And I can tell a person, right, who comes to see me, well, let's see you sit there. Let me see you get up and down from that chair 5 times. Can you do that? And most of them can do that. And then I can say, okay, let's have you go home and build it up over time. I'll give you a schedule. So now we'll do it twice a day. And each time you get up and down from the chair, 20 times twice a day. That's 40 times going up and down from that chair, right? And people can build up to that. So that's a good exercise called a chair squat. But obviously, as you get better at it, as people get stronger, even if they're not used to exercising, we no longer have them sit back in the chair and rock the body back like this to get up and down. It makes it harder if they're just using the chair to measure how low to bend. And they're not going to rock and put their weight back on the chair. They're just going to touch the chair lightly. If that's too advanced for you or you can't handle that exercise yet, you can put a phone book on the chair, a pillow on the chair, a folded blanket or a towel on the chair. You could raise the chair so you measure yourself how low you bend. If your knees can't handle it or you're not in good enough shape to bend that low, you could be bending less low. And eventually you could gradually be taking a towel away and be bending a little lower as you get stronger. So every exercise can be modified to make it less strenuous. And then like this, eventually we move on to chair squats, where we're lifting up, putting most of the weight on one foot by putting our feet in line with each other. Now, in feet in line with each other, we're already now working strength and balance at the same time, right? We're working strength and balance, so we're keeping the feet in line. And over here, I'm lifting the heel off the back foot, touching the chair, and coming back up again, maybe 10 times with one foot in front and 10 times with the other foot in front. And if you can't do that, approximately 15, 20 times with each leg in front, then you have osteopenia or osteoporosis. So now what I did here I have one leg in front, right? And I'm lifting off the back heel, keeping my weight balanced and my weight equally distributed between both feet, okay? And now what I'm going to do is I'm going to keep the heel down in the back, and I'm going to keep the weight mostly on the back leg, so the front leg is just there for support and balance, and I'm doing 80% of the weight on the back leg. So I'm working one leg. So I already just made the exercise more advanced, right? Because I'm doing almost all on the back heel, and I can actually hold the heel or the front foot off the ground if I want to increase, so I have 90% or 95% of my weight on my back leg. Or I can do it, obviously, move it to the next level, where you're doing completely on one foot if you want to be even more advanced. So each exercise can be taken to the next level. Got it? And a chair is a good tool you can hold for support, right? So you can do toe raises to work your calves. A good way to do toe raises is to hold the banister, though, of your staircase in your house, so you can let the heel drop down, and you can do some on both legs and move up, so you can do about 2 sets of 15 or 2 sets of 20 where you're dropping your heel down low, holding something for balance. So that's the one-legged toe raises. The Superman swim and the back extensions are lying on your stomach on the ground, right? Superman swim is lying on the stomach, where I'm on the ground and I'm lifting my arm and the opposite leg up. So I'm lifting this arm up to the back and that leg up to the back at the same time, right? And then I'm doing the other one up. So that's like I'm swimming, so it's working in the back, the lower back muscles. You want to keep the lower back strong. And and then we might do some back extensions. We just pull the back up. Squat jumps is where we're doing actually jumping from a squat position. So squat jumps are that you're just standing there and jumping. And you can jump just straight up and down with your feet right in front, and you can bend down in a more advanced form. You can bend down and touch the ground and leap into the air. So it's jumping, it's bending lower, and how low should you bend? Well, that's dependent on your ability and your level of fitness. Right? So some of you shouldn't bend that low. You should just bend to touch your knees and jump back up again. More advanced would be touching your ankles, and then more advanced would be touching the ground. Now, because I like to ski, I go to a more advanced level of that. I hold weights in my hand, a 25-pound medicine ball, or 25-pound weights in each hand, and I might do squat jumps holding onto weights. And then when I do it that way, I let my knees go out to the side so I can dangle the weight or the medicine ball in between my legs. Right? You could hold them out here, but it's much easier to let them dangle, and you do the squat jumps that way. Got it? Upright rowing, that's just holding a weight and pulling it up, because we want to do some exercises for your lower back. And wide stance toe touch is you know how you shovel snow? If you shovel snow, you're going to hurt your back, right? Because you're not used to shoveling snow. But if you shovel snow every day of your life, you're not going to hurt your back. The point is that we want you to shovel snow every day of your life. You want to be digging and working in the garden. You're not going to hurt yourself when you go dig and work in the garden. And likewise, this emulates that exercise, the wide stance toe touch, because it involves some bending and getting back up again. And we usually do that with some weight in the hand. You don't have to have weights. You can put any kind of thing that's weighty in your hand, but you can have hand weights too. And we're actually holding the weight like you're driving a car, right? And then reaching it down towards one leg and the other leg. And if you want to add to that exercise to make it a combination exercise, we actually extend the other arm out behind you. So you're actually doing a deltoid extension for the back of your arm at the same time as you're doing the rowing motion up and down for the foot. So it gets your back, you're working your back as you're working your arms at the same time with a wide stance toe touch. And jumping and hopping, we talked about skipping rope, hopping, jogging. And as we jog, the higher you pick up your knees, the more you hear the noise, the more you impact the ground, the more tapping and impact, and the more effective it is. And clearly, we want you to think this is a lifetime process, and you want to get in as good shape as you can. So as we get less, when we lose some of our physical capacity after the age of 85 to 95, we still have had so much built. We've done so much exercise through our life that what we have left is much better than anybody else has. So the exercise prescription is the less physically fit you are, the more frequently you have to exercise, right? Because you can't handle an exercise interval that's very intense. If you can't go for an hour or an hour and a half of doing a lot of more stressful and strenuous exercises, then you maybe only can do 5 or 10 minutes. And if they can't, and if the amount of calories you can burn or the amount of fitness your level is low, then you may have to exercise 3 times a day or twice a day because you can't handle too much exercise at one time. If you're really fit and you can do a tremendous amount of exercise, like an hour and a half of exercise with high intensity, you can skip the next day even. So in other words, how often you exercise is based on your fitness. The more fit you are and the more rigorous you exercise, the less frequently you have to do it. So when I have patients that can only walk a block because they have chest pain and they have advanced heart disease and they're coming to me with reversed heart disease and they can't do so much exercise, I have them walk a block every hour of the day. They have to go do their walking, or even more than every hour, maybe every half hour they have to get up. They have to keep doing it over and over again. Okay, and then we want to intersperse interval training, 3 to 5 minutes, something of higher intensity. In other words, we don't want you to just go for long walks. We want you to do something that raises the pulse and makes you breathe heavy and hard. And that's where some of these exercises you're learning today, like jumping rope or hopping or from side to side, you saw I started to raise my pulse and pant a little bit. So it's more like an interval training, so you're not going to keep doing it for hours. It's going to want you to do some intense exercise that tires you out. So when we go to that class in 15 minutes, just in a half hour or so, we want you to put an intense effort in so you feel like you've got some interval training. Because the interval training has an effect to maintain the elasticity and youthfulness of the interior wall of the blood vessels, the best. It pushes the vessels to work hard, and then they maintain their youthful elasticity, vibrancy, and ability to go out and in, because we push them under a lot of pressure. Instead of just doing straight aerobic training, which is like going to running for 20 minutes on an elliptical machine or 20 minutes on a treadmill, it's better you do both, that and the shorter impact that increases the stress on your body over a short period of time. So reviewing this exercise prescription, here we have a treadmill, a bike, a Stairmaster, an elliptical. Which out of those are good or bad or mediocre, or which would you think would be the best for osteoporosis out of those things? Treadmill. Right. The bike and the elliptical are there's no impact. They're great for strengthening, but they're not great. So the Stairmaster, because you're hitting the steps a little bit, and the treadmill, especially on an incline, an incline doesn't increase the stress, but they're all great exercises to do, but they're not as effective at targeting the back or the hips as are some of the exercises we're particularly teaching you and practicing today together, okay? The more you take the weight off your body with water resistance, or even with a rebounder, the more you take away the propensity of the exercise to build bone. Did you follow that? We want to have impact. Now, I realize that not everybody is fit enough or well enough to have impact, but nevertheless, that's still the facts. What I do a lot is I group my exercise into 2 groups. So one day, I'll pick some exercises from pushing exercises in group 1, and maybe that's the day I'll do my osteoporosis exercises. And the next day, I'll rest those muscles, and maybe I'll do different. Maybe I'll do my abs and my back, or I'll walk uphill, or I'll jog, or I'll do curls, and I'll do the pulling exercise, like I'll do curls and rowing and bent over rows and back extensions. And I'll split my exercises so I don't do the same thing every day. So I can still feel like I do something every day, but not get the same, but give the muscles a chance to rest. And by splitting them up, it's not like I don't want to do like my bench press and then my press over the head the next day, because the pressing motion, that some of the same muscle groups are involved, it's not giving those muscles a complete rest. I want to group the exercise so I use all the pushing muscles, pushing down, pushing out, pushing up, and the one day, and all the pulling muscles, pulling up, pulling in like a rowing, pulling down, curling. We want to give the muscle a complete rest, so it's better if we group the same type of exercise, the pulling with the pulling days and the pushing with the pushing days. You got that? The questions about swimming and biking and things like that, and of course there's some benefit to keeping your muscles strong, but the overall effectiveness on building bone and muscle together is not as effective at building muscle or bone as would be weight-bearing exercise, especially because we're talking here about the major areas of the body where women get in trouble are their hips and their lower spine. So if we're trying to build the hips and the lower spine, you're not going to target building the strength of those fine muscles that support the little spinal muscles in the back and the hip muscles enough with swimming and biking. All right? So it's not that it's not good exercise, but I would like you to add something to that routine to make it ideal for you when you get to be 85 or 90, so those muscles are really strong. So that's the last slide. Exercise is not optional, right? When a person comes to see me for diabetes, they get a prescription, and on the prescription it says exercise twice. You take the drugs away, and instead we write them a prescription for exercise. The new prescription is what exercise they're doing, right? Exercise twice a day, exactly what exercise they're doing to their level, and they have a prescription of how to increase it so they're eventually burning at least 300 calories a day in exercise.
Do you have an opinion on whole body vibration?
Yes, there's machines that have vibrating platforms, right? And here's what I found is that the studies show that if you exercise on the vibrating platform machines, they increase the amount of bone mass that can be built with response to exercise. However, most of the machines that cost, what's happening is the machines in the lower price range, $300, $400, are using the studies that the people who make the $8,000 machines are producing. So the strength of the vibration on the cheap vibrating machines, we don't know if they're effective because they're pulling the studies to show they're effective based on those real expensive machines that really vibrate heavier. Did you follow that? So the answer is, unless you're really buying that really expensive machine that costs about $5,000, we don't know how effective it is. The other thing is that we've made available is that at drfuhrman.com is we've tested out various weight vests. And we have a lot of women that have osteoporosis, wearing vests that have weights in them. And as they're leaning over the kitchen counter to wash their hands or wash vegetables and shopping in a supermarket or picking up something from the ground or going even to sit in a chair and getting up, just their normal daily activities of having extra weight, not around your waist, but having the extra weight in the upper part of the body causes them to actually get a lot more stress in their lower back, which has been shown in the medical studies to lead to significantly less back problems and osteoporosis. There was even a study that showed that women who used these weighted vests for a few years, then the vests were taken away for 10 years. And they followed them 10 years later compared to women who never used the vest. And they found dramatic protection against spinal problems and osteoporosis in the back.
I had a question about more serious rowing with a rowing machine, because you are pushing with your legs quite a bit when you're getting a lot of resistance when you're pulling.
Rowing is an excellent exercise for the lower back, yes. Very good for this, because we want to keep that lower back strong.
And hips and everything.
Absolutely.
For osteoporosis, okay.
Yes, very good.
I would like to know what happens if you already have a back problem, and for myself, I have a back problem, I'm up to this high level. And so I don't want it to get worse again, and I want to continue strengthening it, but just more information about how you strengthen your back after you've had a back problem.
Well, see, because your back problem is not the same as this other person's back problem. So unfortunately, in those cases, it's best to give you individual advice and customize the exercise program for your particular needs after we know more about the what your back problem is caused by and its nature. So the answer is it has to be customized for you then.
Very quick question, and nothing really to do with me as such, but this seems to affect women as they grow older more than men. I mean, is there a link between osteoporosis, osteopenia, and menopause? And if so, what is that link?
Well, yes, it's a good question. The answer is that because the American diet style causes an artificial or accelerated a high level of estrogen all through life. So the estrogen level is artificially pumped up by processed foods, by oil, by overuse of animal products. And because of that, the estrogen receptors tune down, or the body doesn't produce as many estrogen receptors as a protective response to the over amount of circulating estrogen. And then when the woman goes through menopause, they've got a low level of estrogen receptors already, so when their estrogen levels drop, they develop estrogen insufficiency that's more severe than it would have been if they had a lower level of estrogen all through life with a heightened amount of estrogen receptor activity. So then after menopause, when the estrogen receptors dropped, when the estrogen levels dropped, there would be more estrogen activity remaining. Did you follow that one? So yes, we want women to move the earlier in life you start taking better care of your health and you eat better, the less you're going to risk having menopausal symptoms.
We have an epidemic of babies being treated with proton pump inhibitors, Prevacid, for reflux, and do you have a comment on that because of the way it's leaching the minerals? And the second question is, I've heard that people can get organic range-free chicken and boil the bones and pulverize them and ingest that as a good source of calcium.
If you're going to eat animal products and not drink milk and not eat vegetables, then maybe boiling and crushing bones might, or taking vitamin bones made from animals that are clean animals might be a source of calcium. But it's not really going to give you the calcium with the phytochemicals, with the vitamin K. In other words, what we're saying here, it's healthiest to get our calcium mostly from plant sources and mostly from green vegetables, because you're not getting calcium in a vacuum. You're getting calcium with thousands of other accessory nutrients. And that's what we're talking about this afternoon. The basics of the nutritarian, or the diet style I recommend, is all based on getting the full symphonic or symphony effect of thousands of both discovered and undiscovered nutrients that maximize the healthy body that you don't get when you eat chicken and chicken bones. Okay, and that's right, and proton pump inhibitors potentially have long-reaching effects on lowering nutrient absorption, on lowering B12 variability, causing calcium loss in the urine, increasing risk of infection, and there's a lot of risks involved with that therapy, and hopefully doctors can minimize the use of drugs and maximize the use of things that make for people have better health, that aren't so fragile and have all these problems. The problem is that, like, even when you see babies that are born with some kind of genetic defects, or they immediately put them on formula feeds or GI feeds and medications. They don't really try to establish the baby's health and allow the own body to try to fix anything, because they immediately start the baby with poor nutrition at the very beginning. So one problem leads to another, and it keeps things getting worse.
What's the role of weight training, both with free weights and machines?
Weight training has tremendous benefits, and we can incorporate weight training into some of these exercises to help make them more effective, like using weights. And I think it's good to do a variety of exercises, including weight training. So we're talking about it. But however, the exercise I described today, we're focused on building hips, lower back, and protecting our bones that you can do with minimal equipment and minimal weights. So you don't need to go to a gym, invest a lot of money. You can do them anywhere in your own home. So there's no excuse or necessity to really have to be in a professional environment to be able to get strong or get fit. So and also, if you don't have time, time is no excuse. You can't say you don't have enough time to exercise, because you could do 10 minutes of exercise. You have time to brush your teeth, you have time to have a bowel movement, take a shower, then you've got time to fit exercise into your day. So the point is, exercise is not optional, there's no excuses. You can do 10 minutes of these. If you have no time, do 10 minutes of these exercises. You don't even have to have the weights. But if you have all that stuff and you want to add on to it and do more, I do a lot more than just this. I do weights, I play tennis, I run, I ski, I jump over and down. I do a lot, I bike, I do a lot of things. But at least do the minimum, do this and add those things on top of this, okay?